It's that time of year and you're due for your annual pap smear. Or maybe it's your very first one and you're nervous and you don't know what to expect. Well, let's get into it today. Stay tuned. Hello and welcome to my channel. I'm Dr. Renita White, a board-certified OBGYN, women's health expert, and mother to 2 boys, and this channel is all about taking care of yourself and your health. Today, let's talk all about pap smears. You've been told you needed to have one before, maybe you've had a few of them and you don't even know what they're all about. Well, let's get into it. Anyone can get cancer on any part of their body, the brain, the breast, the bowels, and also the cervix. So the goal of a pap smear is to screen for cervical cancer. So how is this done? When you go in for your annual wellness visits, this is usually the setting in which a pap smear is done. Even though these visits do a lot of different things, a lot of talking, other parts of a physical exam, including a breast exam and heart and lung component of the exam, the pap smear is a specific part of the test where something called a speculum is inserted into the vagina so that the cervix can be well seen. Sometimes people think that the pap smear is the speculum itself, but the speculum is used for so many different things. When you're getting tested for STDs, when we want to make sure that the vaginal tissue and discharge looks normal, for placement of things like an IUD. So don't assume that because a speculum was used, that it was the purpose for a pap smear. So, once a speculum is inserted, your doctor is going to be able to see the cervix, which is the bottom of the uterus. Though they can only see the most outer portion of the cervix is actually a tube that's about 3 or 4 centimeters long. The tissue on the inside of the tube is a little different than the tissue on the outside. So this is collected during the pap smear. Now, how is this collected? Once your doctor can get that cervix in view, there's a brush or a spatula looking device that's used to swab the cervix. It shouldn't hurt, almost like swabbing your hand shouldn't hurt. It may feel weird or uncomfortable, but definitely not painful. Once this swab is done, the doctor sends it off to the pathologist, who's a specific type of doctor that takes a look at these cells under the microscope. When doing that, they're able to give you basically a grade, which is normal, or if it's abnormal, there can be a range of results. This helps us to know what follow-up should be. Majority of people who have pap smears are not going to have cervical cancer because the goal is to capture cervical cancer before it happens. So for those who have an abnormal pap smear, meaning if the cells did not look normal, there's usually a grading scale to go from least severe to the most severe. Also in this setting, we also want to know your HPV status because we know that HPV can be linked with cervical cancer. Majority of cervical cancers are due to the HPV virus, HPV standing for human papillomavirus. Now this virus is pretty tricky because it's passed back and forth between a lot of people, mostly through sexual activity, but there's no way to test for it outside of pap smears. There are over 100 strains of HPV, but there's only a few that we think can be linked to cervical cancer that we know of. So when your doctor is testing for HPV, we're testing to see are those strains there that are linked to cervical cancer. HPV is only tested based on your age, usually for people who are over 30, or if you've had an abnormal pap smear. So it's not going to happen every single visit. So after your pap smear is done, you'll usually get your results back within 1 week. If your results are negative, then you probably don't need another pap screen or cervical cancer screen for another 3 to 5 years. If your results come back abnormal, then your doctor will talk to you about the different options. One option could be to repeat your pap smear in 1 year. Another option could be to go on to something called a colposcopy. This is a specific type of procedure that gives us a closer look of the cervix. So this time, once that speculum is placed, your doctor's going to get a really close look at your cervix because the colposcopy is basically a microscope. With this procedure, your doctor is going to get a very close look to see what areas turn an abnormal color when a specific solution is applied to the cervix. If an abnormal color is seen, then we know to take a biopsy of that area. That way, the pathologists have not just a few cells, but a microscopic thickness of tissue to see really deeply, is there any increased risk of cervical cancer? Now, let's say that you have a history of abnormal pap smears that are more advanced or severe, or maybe it's your first one and you're older. Well, this may be a situation where your doctor is going to recommend a procedure in order to treat your abnormal pap smear. This procedure is called the LEEP procedure, Loop Electrosurgical Excision Procedure. I know, it sounds crazy and scary, but trust me, it doesn't have to be. So for people who have really advanced or high risk abnormal cells on their pap smear and follow-up biopsy from the colposcopy, then a LEEP procedure may be prescribed or recommended for you. Well, this is a procedure where the most bottom or external layer of the cervix is removed, usually less than 1 centimeter's amount. And don't forget, the cervix is about 3 to 4 centimeters. By doing this, this is not only removing the abnormal cells that could potentially lead to cancer, but preventing any potential abnormal cells from moving up the cervix and leading to cancer. Some people do this in the office and some people in an outpatient surgery center, but regardless of how it's done, we make sure that you're comfortable with medications and numbing medicines in order to make sure that you don't feel a thing. LEEP procedures should not impact fertility or your ability to get pregnant in the future. So next time you've got to go in for your pap smear, don't be scared. You've got this, girl. Know that you're ready to get your questions answered and you know exactly why this test is being done. And when in doubt, talk to your doctor to make sure that you're fully informed and fully comfortable before moving forward. All right, so stay tuned for the next episode next week. And is there anything you want to hear? Message me below. I'd love to hear about it in the comments. Or send me an email at hello@renitawhitemd.com. See you next time.